Okay, I am here today with Dr. Vicki Jurevic. Thanks for joining us, Dr. Jurevic. And
Thanks.
let's start out a little bit with can you share a little bit about your background and what inspired you to pursue nursing?
So I've been a nurse a really long time, so I'll try to keep this brief. My first degree in college was physical therapy, and back in the 80s, it was very competitive, and I only had a 3.6, and so I'm like, nope. Switched to psych for a semester, too many classes with Freud and penis envy. I was couldn't handle that, and I switched to nursing and have never been sorry. And even when I was like in second grade, I wanted to be a nurse, but my grandmother had talked me out of it. So I came back to where I really wanted to be. I always was good in science, math, knew I wanted to do something to help people. And so I've been a nurse for over 30 years. I have done a little bit of everything, med surge, um, medical telemetry, cardiac telemetry, nursing education, med surge, if I didn't say that, case management. And I just love the profession. It's hard, but it's worth it every day.
Okay, thank you. What specific specialty do you work in now, and how did you choose that path?
So currently, I work as a nurse on the floor on a medical telemetry floor, and cardiac is my specialty. I'm certified in cardiac. And when I decided to go back to working on the floor, I knew I wanted to go back to the hospital where I'd worked most of my career. And I just wanted to be in cardiac. So I couldn't go back to my original floor because my husband worked there at the time. And I'm really kind of glad I didn't end up back there. This floor is geriatric population. And while it's difficult, I find that I'm able to provide a new part of my knowledge and skill trying to help these patients who really need some of that extra TLC.
Okay, what does a typical day look like?
The floor I'm on now is very busy. I usually have four patients. Um, I don't get lunch most days. I might grab a fruit snack or the little fruit pack that I grab and eat that quickly. But I'm so busy going from patient to patient and sometimes getting labs and tests and giving pain medications, assessments. It's busy. I don't sit hardly at all. But that's typical in any nursing job that I've ever done. So I only usually do 8 hours. So I get there at 7. And a good day is normally I'm scheduled 7 to 3:30. A good day is if I'm getting out at 4. Many days I don't get out till 4:30. Just because I go back through and double check on my charting, make sure that it's done and all my I's are dotted and T's are crossed. So I'm usually taking care of stroke patients. So those patients tend to have a lot of extra needs as far as turning frequently and potentially mouth care assistance. So it's a very busy floor.
Well, what do you find the most rewarding about your specialty?
With the cardiac patients specifically, I love being able to do the education. There's a lot of patients who have heart failure, which is something in nursing school you'll learn lots more about that. But because that's where my passion for medical patients, cardiac patients is, I'm able to do that teaching. I also, pardon me, like to help. Sometimes patients are just so afraid and that when you can be that person who sits down next to them and show them that you really care and that you're listening, even as busy as I am, sitting down and giving them that time where I'm looking them eye in the eye and I'm not charting, that's just so important. They need to feel heard and they need to know that somebody cares about them. And so, no matter what type of nursing I'm doing, I'm going to be able to provide that anywhere. But with these patients, they're a little bit elderly, and so sometimes they don't have the support that they need.
On that same note, what do you find to be the most challenging?
Challenging for this population or nursing in general.
For your specialty?
The amount of needs that they have. So when you have somebody who can't order their food for themselves, when you have somebody who can't turn and you're trying to prevent those health acquired pressure injuries, making sure that they're getting the mouth care because they can't do the mouth care and they're not drinking because they have swallowing problems. Trying to ensure that all those things that people might consider little and not important, think if that was your mom or your grandma or somebody you loved, you don't want their mouth getting all nasty and caked or getting a sore on their bottom because it hurts. So trying to do those things can be challenging, but also rewarding when you know you're making a difference.
Definitely. Thank you. Well, what do you wish you would have known as a first year nursing student or as a new nurse going into this specialty?
Somebody had told me when I was in nursing school that, okay, you know, and I say this to my own students, sorry, I teach too, but when you graduate from nursing school, we've now prepared you to really start learning because there's so much you can't know when you get out. And so don't be afraid to ask those questions. The new nurses that scare me the most are the ones who think they know it all. And even as a nurse of 30 years, there's not a single day that I don't have a question. And so trying to make sure that you are asking the right questions to the right people so that you're keeping patients safe is important because things change constantly. The tubes that we draw blood in, one week it's this color, the next week it's another color. And so making sure that you're not sure, you ask somebody, and nobody's thinking less of you. We worry more when people don't ask questions.
I could not agree more. Nice. Well, can you share a memorable experience from your nursing career that impacted you?
Pardon me. Gosh, there's so many. Um, I had a patient at one point when I was a case manager. I also did what was called wings coordinator. So it was women in need of grief support. And I had a young female patient who had lost her baby at uh, 20 weeks. And the baby had what's called anencephaly, where it didn't have a skull. So the baby wouldn't have lived either way. And I went and got the baby from the morgue and brought it up for the mom to get to hold and see. And the patient was only 16.
Oh,
And
wow.
she had no support services, nobody there, no mom, no baby, daddy, nobody was there. And I remember being so worried about how she was going to handle it. And I sat in the room just off to the side, and she took a rose and rubbed it on the baby's face and said, "Isn't she beautiful?"
Oh,
And
wow.
that mother's love, and that time that I allowed her to grieve and mourn and say goodbye, that opportunity, I'll never forget that experience. And although I was just a backseat person there trying to let her have her time, you just don't know in nursing where you're going to go and the different experiences you're going to have. And just being there for those patients again is just key.
Even though that was a very intense experience, sounds like it gave you something as well as being very cathartic for the patient. So isn't that
Oh,
interesting how that happens sometimes?
yeah, always. Anytime I know I'm making an impact, it takes me, I go home and even if the day was really busy and my feet hurt badly and I'm like, oh, I was able to help this patient. I feel like I was really there specifically for this patient. I had this knowledge and I could really help them. And so there's very few days that I go home and I don't feel that in some way or fashion. So
And isn't that interesting how that experience has stayed with you for many, many years? So imagine that patient that you remember her. I guarantee she remembers you as well.
yeah, this probably happened 20 years ago, and I still can tell you all the details
Wow.
if I was allowed.
Well, on that same note, how do you cope with those emotional challenges that come with your specialty?
I'm a verbal processor, so I like to be able to share frustrations. So my husband's a nurse also, so sometimes that's good, sometimes it's not. But if I come home and I've been particularly frustrated with a physician who was being difficult or wasn't responding as quickly as I wanted them to, or I had a really sad outcome for a patient, or I was really worried for somebody, being able to just share that with my husband without going into any details that would violate HIPAA is what helps me. So I'm a verbal processor. If I didn't have that, then I would probably journal, because just being able to go through those thoughts and processes helps me to kind of tie a bow on it and move forward.
Okay, thank you. How do you see your specialty evolving in the next few years?
Well, geriatrics is not going to go away. The current patients that I'm taking care of, stroke, the risk factors for stroke are only increasing in the United States with obesity and hypertension, all the things. So there's going to be an increased number of patients who need our help. And it's so hard that sometimes people don't want to stay on those floors and take care of those patients. And so even though I only work part-time for that floor, I realize that that time that I'm giving them is helping them, but it's only going to grow. And the resources, if we don't have good patient care assistants that we're working with and working as a team, helping each other, I don't know how it's going to be manageable in the future if we're not really being proactive and forward thinking.
What skills and qualities do you think are essential for success within the nursing field in general?
Patience. You need to be patient with yourself, patient with the families who are stressed and asking you a bunch of questions. You have to understand that they are scared. You need to have exceptional assessment skills. You need to be detail oriented and diligent. Part of what takes me so long on my patients with my assessments is they're elderly. And I'm lifting up every heel and I'm looking up under every heel and I'm lifting up those elbows and I'm looking under those elbows and taking the time to be checking for those pressure injuries on those patients. It's critical. You need to be an effective communicator, but kind communication, especially with secure chat. It's so easy to text, and many people are really adept at texting. But how does that message come across if you don't at least just say good morning to somebody? When I text somebody in a secure chat, I try to say good morning, or hi, and say things, thank you. If you're not doing that, what kind of lateral violence and problems are you going to have? So, and then time management. Time management's key. You have to be able to keep abreast of what's the most important thing to be doing. And that can change minute to minute. What my plan was 5 minutes ago may very well change in a couple minutes based on new data that I get on another patient. So, good communication, detail oriented, time management, and just be kind.
Yeah, I could not agree more with all of those for sure. Well, to end this, do you have any pieces of advice or wisdom for these freshmen and sophomore nursing students in Nursing 252?
The most important thing while you're in nursing school is to remember that you've got to take everything forward. As a nursing educator for many years and as a nurse who works on the floor, being able to pull the knowledge that I learned early in my nursing career, it never goes away. And so, one of the best things you can do to do that is to not cram before exams. When you cram before an exam, you just put it in short-term memory, and then later on, you're not going to bring it forward. So, really be in your material daily, even if it's 10, 15 minutes. And that's 10, 15 minutes without the cell phone, without TikTok or Snapchat or whichever newest thing is. It's 10, 15 minutes of I'm really going to review this so that you're putting it into long-term memory. I did that in nursing school, and that is why I could still tell you some OB things, even though I've never worked OB in my life. So, really study to remember that I need this to take care of patients in the future so that you are catching the things that you need to know and that you're going to test well and potentially save somebody's life.
Good advice. All right. Thank you, Dr. Jurevic. And these students will all see you in class because you will have them as well during their time here at Miami. Thank
I
you.
look forward to getting to know you guys.